We have already read that at the point A, the salmonella enter in your body. At the point B, the salmonella goes into intestine, and at the point C, point C, salmonella goes into the blood. So when the salmonella goes into the blood, the symptom started. The patient becomes symptomatic and fever started. Now, for understand the topic, we divided the duration of the disease into three parts. That is from the onset of the symptom, that is from the point C. We divided the whole duration into first week, second week, and third week. Now, when patient becomes symptomatic, and at the point C, patient come to you, and in the first week, your investigation of choice would be IOC is blood culture. Because only by the help of blood culture you can diagnose the presence of typhoid in the blood. And but the typhoid the bacteria salmonella present in the two part, that is one is in the intestine and one in the blood. But by the help of the blood culture you can diagnose the presence of bacteria in the blood, and at that first week there is no antibody, so there is no role of the Widal test in the first week, and also the Widal is not a diagnostic test. Now in the first week, when after the diagnosis, presumptive diagnosis, or by the help of blood culture, you diagnosis the bacterium present in the blood, you started the treatment. So between the start Rx. So at the first week, you started the treatment. You give the IV antibiotic, mainly the ceftriaxone. So you give ceftriaxone. Now the bacterium present in the blood and the intestine. So by the help of IV antibiotic, that is IV ceftriaxone, you can only deal with the bacteria which is present in the blood. So IV antibiotic clear the bacterium from the blood, but it does not act on the intestinal flora of the bacteria. So bacteria still present in the intestine. So at the point D, the antibody formation started. So after the first week, that after the point D, we can do the Widal test. Now Widal test is not a diagnostic test, it is a prognostic value. We have already read that from the first week itself we start the treatment for the typhoid, and we do Widal test at the point D, that is after the first week we do a Widal test. Now Widal titer at the first week, the value is imagined now 1 is to 300, and you have to do the Widal test after the 2 week. After the 2 week, the Widal test is the titer value is 1 is to 40. What is signified? It signifies that your treatment is responded. That is, your treatment is right, the titer fall down, so it has only the prognostic value. Why it is not a diagnostic test? Because the Widal test is not specific for the salmonella, it is false positive in other cause also. So it is not a diagnostic test. It tells only the it has only the prognostic value and tells about the clear of the bacteria from the blood only. Now we have already read the bacteria present in the two area, that is one is intestine and another in the blood. Now Widal test only signifies that your bacteria is clear from the blood, but bacteria still present in the intestine. Now after starting the IV therapy, that is IV ceftriaxone, that clear only the bacteria from the blood. Now bacteria still present in the intestine. If you imagine the bacteria, so bacteria now at the third week in this week, the bacteria is already clear from your blood but present in the intestine. IN stand for intestine. Between the E and A, the bacteria is still present in the intestine. Now, as a result, bacteria is shed off in the stool. Bacteria is shed off in the stool. So, at this point, your diagnosis investigation of choice is IOC is IOC is IOC is IOC is stool culture. Stool culture. Stool culture. And why we do stool culture? To to know the if the bacteria is present in the intestine or not, and to treatment the intestinal flora we give ciprofloxacin or ofloxacin, that is floxacin group of the in the oral form, and clear the bacteria from the intestinal flora. So what's the point? That is at the point, so bacteria by the fecal rule goes into the intestine, and it causes the mild ulcer. The ulcer in the typhoid is longitudinal ulcer, and the bacterium invade the blood vessel and goes into the blood. Now the bacterium present into two areas, one is intestine, one in the blood. Now the first week, your investigation choice is the blood culture, and you treat you start the therapy, and that therapy, IV therapy, clear the bacterium from the blood, but bacteria still present in the intestine. So as a result, bacteria is shed off via the stool, and after the third week, your investigation choice is stool culture. So in the case of the Widal state become positive after the first week, and it is not a diagnostic test; it is a prognostic value. Thank you.